Okay, so let's talk about the structure of the heart. So first of all, the heart is located in the cavity known as pericardial cavity. Does that make sense? I'm going to draw it like schematically. So imagine that this is pericardial cavity, right? This is the heart. Of course, it is anatomically incorrect. I'm not drawing the actual heart. Does that make sense? So the heart is covered by a layer of serous membrane that is called visceral pericardium. Does that make sense? And the walls of the cavity are covered by the parietal pericardium. This part, are we clear? That makes sense. Now, the space between the visceral and parietal pericardium is called pericardial cavity. So this one here is the cavity. Cavity is filled with fluid. Okay. Make sense? And here's your clinical relevance. Imagine that due to some reason, say due to the inflammation, check this out, the fluid in the pericardial cavity starts to accumulate. How do you think the accumulation of the fluid around your heart will affect the heart capacity to contract? It will be harder, right? It won't be able to properly expand, right? So this condition, the inflammation of the pericardium, is called pericarditis. Usually infectious. Does that make sense? So if you watched any medical shows and a person, they scream, "Oh, yes, pericarditis," and they take a giant needle and just stab him in the chest and suck the fluid out. Yeah, that can happen easily. Does that make sense? A colleague of mine had about 2 liters of fluid removed when he had acute pericarditis. Okay. Now, I want to add that the parietal pericardium is continuous with so-called fibrous layer of pericardium. Basically, your heart is really well attached. That's all you need to know. Now, so far, does that make sense? So, again, parietal pericardium covers the cavity, visceral pericardium covers the outer surface of the heart. Does that make sense? We good? Good? So if you look at the wall, of the heart, the cross section, it has 3 layers. Okay, so outermost layer, which is a visceral pericardium, is also known as epicardium. Okay? The central layer is myocardium, which is cardiac muscle. And the deeper layer, this one, the deepest one, right? It's endocardium. This is the simple squamous epithelium that covers the heart from the inside. So now the rest of the conversation, I'm going to be holding here. I will have the model to illustrate what I'm talking about. We good? I'm just checking that you can see. So first of all, these layers, of course, are not that proportional. The pericardium is pretty thin, endocardium is just 1 layer of cells. Does that make sense? Myocardium is the most. So here's the heart. Again, as I mentioned before, the outer surface is covered in visceral pericardium, the inner surface here will be covered with endocardium, endothelial cells, epithelial cells, and that these thick walls is the muscle. Okay? So heart consists of 4 chambers. Here you can see in this model, you can see 2 atria and 2 ventricles, right? And this heart is positioned just like, a proper heart. So this is the right atrium, left atrium, right ventricle, left ventricle. Does that make sense? Atria and ventricles are separated by septa. So this wall right here is interatrial septum, and this is interventricular septum. Does that make sense? So septum in Latin, I think, means a wall. Okay? So far we good? Now, what about other structures? First of all, do you see this structure here with the kind of fibers in this one? So these are valves. Can you see these valves? These valves are commonly called atrioventricular. Do you follow? Atrioventricular, because they separate atria and ventricles. And specifically the valve that separates right atrium and right ventricle is called tricuspid, while the valve that separates left atrium and left ventricle is called mitral or bicuspid. Does that make sense? So atria are receiving chambers, ventricles are pumping chambers. Atria receive the blood from corresponding veins. The right atrium here receives the blood from the vena cava. I'm going to be holding the structures that I'm talking about now. Superior vena cava or inferior vena cava. Not or, and. Superior and inferior vena cava. Does that make sense? Now, left ventricle here receives the blood from pulmonary veins. They are red here. Okay? I don't know if they're numbered. Yeah, on the models that you have, they're numbered 19. 19 and 18. 19 are left pulmonary veins and 18 right pulmonary veins. So far, does that make sense? Now, what about ventricles? So ventricles pump the blood. Specifically, so you have a right ventricle that is on this side here. This right ventricle pumps the blood into pulmonary trunk, which can be seen here, and part of it, let me put this thing together. So do you see pulmonary trunk here? So right ventricle pumps the blood into the pulmonary trunk, while left ventricle pumps the blood into the aorta. Okay, so this is aorta. Now, if you look back into the structure of ventricle, so you can see that left ventricle, when it pumps the blood into the aorta, blood has to go through another valve. So this valve here is one of 2 semilunar valves. This is the aortic valve. Now the valve that separates pulmonary trunk from the right ventricle is second semilunar valve, and it is called pulmonary valve. So far, are you following me? Now, these structures that support atrioventricular valves here and here are called chordae tendineae, connective tissue structures that basically allow valves to open and close. Okay, these are papillary muscles. Okay, I'm thinking about the anatomy, and now we are. Any questions on the anatomy? We're gonna do the functional anatomy in a second. Okay, I just wanted to show like main structures. Okay, we good so far? So, some of the structures outside of the heart. So on the anterior surface of the heart, you see these flaps that are called auricles. Auricles increase the volume of the atria during the filling of the heart with blood. Now, these blood vessels that run along the auricles here are called right and left coronary arteries. Coronary arteries supply the blood to the heart muscle itself. Am I clear? Does that make sense? Now, this in the center, you see this artery here? This is anterior interventricular artery. I always break my tongue. There are too many R's for a Russian tongue, okay? That makes sense? So all these blood vessels that you see around here and here supply the blood to cardiac muscle. Am I clear? Blood is drained from the cardiac muscle through the posterior venous sinus. Can you see that? Okay? So, and then the venous sinus drains the blood into the right atrium. What do you need to know? So anatomy, I leave it on you. What do I want you to know sort of clinically? Think about this. If a small blood clot blocks the flow through one of these arteries and blood does not reach the cardiac muscle, what do we call this condition? It's a heart attack, myocardial infarction. Does that make sense? So it's the type 1 myocardial infarction, classic myocardial infarction, when clot occludes one of the coronary arteries. Does that make sense? Now, type 2 myocardial infarction happens when blood cannot flow through the coronary arteries for some other reason. It can be atherosclerosis. That makes sense? When there are fatty plaques within the blood, within the vessel. It can be vasoconstriction. Okay? And it can be basically a combination. Sometimes it's a supply-demand imbalance. What are two days in a year, broadly speaking, when middle-aged men like me have most myocardial infarctions? In Ohio, okay, let's narrow down because it would be very unusual for Louisiana, for instance, but in Ohio, Pennsylvania, 2 periods, so to say, of the year. So think of it this way: supply-demand imbalance, right? Which means blood flow through the coronary artery is insufficient for hard-working heart. And when your heart suddenly starts to overwork, for a middle-aged man like me, it's first big snowfall when I go and clean the driveway. And second, you're not going to believe it, first days of the year, when people try to comply with their New Year resolutions and they go to the gyms and they're not trained enough, they start working out and have a heart attack. That makes sense? A friend of ours, she works at the ultrasonographer, she says every year, the first snowfall, and we have a flood of middle-aged men who tried to shovel the driveways. Okay? So that's an example of supply-demand mismatch. So far, we good on this? So let's do but functional anatomy of the heart. So this is functional anatomy of the heart / blood flow through the heart. So if you think about it, the function of the heart is to distribute the blood throughout the body. Does that make sense? So if we draw a schematic heart like this, okay, with this being right atrium, right ventricle, left atrium, left ventricle, okay? So if you remember, what are two blood vessels, really large blood vessels, that bring the blood into the right atrium? Anyone remembers? Vena cava. So let's say it's going to be superior vena cava and inferior vena cava. Now, maybe a little bit more complicated question, but this blood is brought to the heart from where? Where does this blood come from? I'm giving you two options: lungs or the body. The body. So all the tissues, all the muscles, liver, intestines, stomach, you name it, everything. Eventually blood drains into the vena cava. So this blood that goes through the vena cava into the right atrium, is it oxygenated or deoxygenated? Does it have a lot of oxygen or very little oxygen? Deoxygenated. Does that make sense? The blood that comes in is depleted of oxygen, so we're going to draw it in blue. So once the blood enters the right atrium basically pumps it into the right ventricle, right? And it has to go through the valve. So that valve that I showed you, this valve here, the tricuspid valve, separates right atrium and right ventricle. Once blood is in the right ventricle pumps it through the pulmonary valve into the pulmonary trunk. Okay? Now, what is and we're gonna say that this is the blood from tissues. Now, the term pulmonary refers to which organ? Lungs. So this blood here goes to the lungs. What happens in the lungs? Yes, blood becomes oxygenated and it returns from the lungs into the left atrium via pulmonary veins. Does that make sense? We good so far? Good? So it returns through the pulmonary veins, and then from left atrium, it enters left ventricle through the mitral valve. Now left ventricle pumps the blood out through the aortic valve into the aorta. And blood goes to the tissues. Does that make sense? So, one more time in a whole flow. Deoxygenated blood from tissues enters the right atrium. From right atrium, through tricuspid valve, it enters the right ventricle. And from right ventricle, through the pulmonary valve, it enters pulmonary trunk. Pulmonary trunk branches into pulmonary arteries. I didn't picture it here. And blood is delivered to the lungs, to the pulmonary arteries. Does that make sense? In the lungs, blood gets oxygenated and returns back to the heart, into the left atrium via pulmonary veins. Then it flows from left atrium into the left ventricle by mitral valve. And left ventricle pumps the blood through the aortic valve into the aorta, which delivers the blood to the tissues. Am I clear? And the whole cycle starts over. So this is blood flow through the heart. There will be quite a few questions about this one. I strongly recommend to be able to draw this. It is super helpful. Okay? Does that make sense? So, I'm going to ask you a few questions. This is fun to talk about. I'm not doing that in the particular order, but it feels like it's a good time to talk about it now. So first of all, what is the difference between arteries and veins?
Veins make the blood flow?
No, they're all blood vessels, but all blood vessels, right? Arteries, veins, all blood vessels. The organ that makes the blood flow is the heart. What is the difference? The answer is right here.
Oxygenated or deoxygenated?
Nope.
Or carrying from the heart or away?
Yes. So veins always carry the blood to the heart. Does that make sense? Arteries always carry the blood away. Does that make sense to you all? That's a rule. That's a definition of veins and arteries. And actually, in regards, so look at this. Look at this. Can a vein carry oxygenated blood? Of course. Here you go. Pulmonary vein, right? Can an artery carry deoxygenated blood? Sure, pulmonary one. I have another question, which is 3 to 4 out of 10. Okay, I'm going to ask it in the really, really, really hard form, without giving any hints. Can you think of one another instance, one another anatomical structure, where veins will carry oxygenated blood, and arteries, basically a vein and an artery, will carry deoxygenated? No. In the liver, veins still carry deoxygenated blood. Artery carries oxygenated. I'm going to give you a hint. Think about fetus. It's a hard question. You don't have to use specific anatomical terms. Does a fetus have lungs? I'm talking like, say, 7-month pregnancy. Yeah, they do. Do fetuses use lungs? Do you have kids? Do you have kids? Do they breathe in there? Like, respire? Do kids respire? Do fetuses respire when they are in the womb? There's no air. There's no air in the womb. Not supposed to be, right? There's no air. So how do they get oxygen? That structure, right? It starts with P. The placenta. Right? So, the blood that goes from placenta to fetal heart, is it oxygenated or deoxygenated? Oxygenated, because this is where they get oxygen. But it goes to the fetal heart through the umbilical vein. So the blood in the umbilical vein is oxygenated because it goes from placenta to the heart to be distributed, right? And the blood that goes from the fetus to the placenta is deoxygenated. It goes away from the heart, so it's umbilical artery, but it carries deoxygenated blood. That makes sense? Another thing. So basically here we have two circuits. One is pulmonary circuit. Does that make sense? And another one is systemic. Okay? Are we clear so far? Okay, so here's the question. Which circuit, pulmonary or systemic, is bigger? Physically, anatomically bigger? Systemic, of course, yes. Yes, you have a lot of tissues, a lot of organs, liver, kidneys, stomach, all intestines, brain, all that kind of stuff, muscles for that matter. Am I clear? Trick question. Which circuit has more blood? The phrase trick question was a hint. Yes. The blood volumes in systemic and in a pulmonary circuit are the same. Does that make sense? So next question. If pulmonary is much smaller and systemic is much bigger, but the volumes are the same, in which circuit the rate of blood flow will be higher? In which circuit the blood will flow faster? It's tempting to say pulmonary. But think of it this way. Imagine that you and I are in the race. So your race is to walk around the campus. Like we start at, the clock tower and have to go back to clock tower. We good? What you do, you take this nice route around the campus. What I have to do, I have to go to 306, go all the way down, turn 6:15, whatever, 6:15, and then go up Garfield Road, do the whole 9 yards, right? And come back to clock tower. So yours is 1.25 miles, mine is 5 miles. Who will have to drive faster so we can be at the same time? I would, right? So same volume of blood has to go through much bigger circuit in the same amount of time. That makes sense? So blood flow, the rate of the blood flow in the systemic circuit is much higher. Therefore, blood pressure, in which circuit it is higher? The systemic, yes, blood pressure in the systemic, because the resistance is much higher. You have more pipes. By the way, it is useful, listen, it is useful to think about circulatory system as, look, the pump with a whole bunch of pipes. Does that make sense so far? Which circuit is flimsier? I mean, I don't know. So which circuit will be more prone to the damage from the pressure? Systemic, or like if you have a spike in the blood pressure, which circuit will be more prone to the damage? Systemic or pulmonary? Pulmonary. Because systemic circuit is used to high blood pressure, right? The pressure in the pulmonary circuit is low. So that actually explains one of the interesting outcomes. When people talk about hypertension, usually it refers to systemic hypertension, mostly, okay? When people have chronic pulmonary hypertension, it is terribly dangerous, like edema in the lungs. Does that make sense? Because it's so flimsy, it leaks easily. Does that make sense? We're gonna stop, because I thought about talking about congestive heart failure, but we'll save it for cardiac output. Any questions about the blood flow? Nope. Okay. Little note. So coronary arteries, these ones, the red ones on the surface, they start at the very beginning of aorta. Like they branch right away. Okay.